with Live with the Doc. This is a new series with Dr. Vincent Leonti, certified hyperbaric practitioner. Today, we're going to talk about how to age gracefully with the use of hyperbarics. HBOT has shown to combat degenerative conditions by contributing to the regeneration of tissue and blood. Today, Dr. Vinny is going to talk to you a little bit about what hyperbaric oxygen therapy is for those of us that this is completely new. This is our newest healing modality. He'll talk about chronic inflammation and how that affects aging. And he's going to talk about why hyperbaric oxygen therapy is considered a miracle for anti-aging. So let's kick this off today, Dr. Leonti. Thanks for being here.
Thank you, Regina. Let me just talk briefly about hyperbarics and what it is for people who are not familiar. So hyperbarics is being in a chamber where we can pump air in and increase the pressure in there above atmospheric pressure. That changes the way we get oxygen because it increases the pressure of oxygen in the air around people. And that extra oxygen flows into their body, into their tissues, into their cells, and all the way to the subcellular level to the mitochondria, where it increases the mitochondria's ability to produce energy and to therefore ignite healing. So that's essentially what a hyperbaric chamber is and does.
Excellent. Awesome. Dr. Vinny, can you talk a little bit about chronic inflammation and why it's the root cause to so many diseases and how it can affect aging?
Yeah, when something goes wrong in our body responds with inflammation. Now that's a good thing sometimes. I mean, if you get an infection, if a hair follicle gets infected, or you get an infection in your finger or elsewhere, you want your body to respond with inflammation and white blood cells and to take care of that infection, the bacteria that's there. So that's great. That's acute inflammation. Chronic inflammation is not usually related to things like that, though sometimes people get chronic infections that lead to chronic inflammation. But it could be chronic inflammation could be related to a bad diet, or it could be related to Lyme or mold and mycotoxins or heavy metals. Many of the things that are now causing the epidemics we are seeing of chronic disease, autoimmune disease, cardiovascular disease, chronic environmental illness due to some of the things I mentioned, like mold and mycotoxins and Lyme disease. Mm-hmm. So if you get into a situation of chronic inflammation, it's now become, not healthy for the body. It actually accelerates the aging process, if you will. Mm-hmm. And we'll see that. We'll see a slide on that in just, I think, a couple of minutes. Because if you have inflammation, the body cells don't work properly. And that leads to metabolic dysregulation, and that leads to the more and more inflammation and things not working well.
Yeah, I'm actually going to pop on these slides. All right. Now, can you talk a little bit about how hyperbaric oxygen can intervene with chronic inflammation and the aging process?
Yeah, actually, why don't we go back to one of the other slides, Regina, the one that looks like this, but yeah, this one. Okay. So yeah, this is an illustration of what happens with chronic illness. You get inflammation, and that leads to blood flow being reduced. It increases the inflammation. With the increased inflammation, reduced blood flow, the cells don't work as well. They can't produce energy as well. They start putting out toxic products. That leads to the immune system getting dysregulated. For some people, that results in autoimmune conditions. Increased reactive oxygen species. These cells are putting out oxidative molecules that disrupt the signals to other cells. And that eventually leads to damage around the genes so that they're not working as well. Ultimately, that leads to tissue damage. When that happens, blood flow drops even more, and then the cycle just keeps repeating itself. Why don't we look at the one with chronic aging now? Here we go. Well, aging is chronic, I guess, but with the aging process.
Yep, can't avoid it.
So, you know, some of the same problems are in play, where with aging, our circulation is not as good as it was. Many people complain about that. That leads to, you know, mitochondrial dysfunction. If we start over here, and cells age and we don't renew them properly, the stem cells, which create new cells, get exhausted. Cell communication is disrupted, as we said. That leads to the genes not working properly. Telomeres, those pieces at the end of chromosomes that, as we age, get shorter and shorter. That continues. That process can accelerate. And people are oftentimes, they have what deregulated nutrient sensing, so they're not really, the body really doesn't know what to eat anymore. So, you know, they're not getting the proper nutrients and that kind of thing. So all of this leads to what we call the changes of aging, which is usually changes again in circulation and inflammation. It doesn't say their joints ache as they're getting older and that kind of thing. So.
Absolutely fascinating. This is such an amazing healing modality. And so
I'm sorry, go ahead, finish up.
I was just going to say, Dr. Vinny, so not just, you know, healthy aging for your skin, and it can promote, you know, collagen and elastin activation, but this is, hyperbarics really helps aging on a cellular level.
Yep. Yeah. So why don't we see that side on how it can reverse some of these processes?
Mm-hmm.
So with hyperbarics, what's happening is the cells are getting increased oxygen. They're being perfused with increased oxygen. That leads to increased blood flow, which decreases the inflammation, which instead of metabolic dysregulation leads to metabolic regulation. Helps the immune system to modulate and work better. The reactive oxygen species, which are damaging to cells, are now decreased. Cell signaling improves. The epigenome, which helps, transcribe proteins from the DNA, starts working better. That leads to now tissue repair instead of tissue reduction. And then this process, now, instead of the vicious cycle we were in before, I call it the virtuous cycle, where things are actually getting better and better. It does not make us immortal. It just can slow down our aging process and make sure that we age better, more gracefully, more energy, can do the things that we want to do. So, it does also, that's not the topic of this talk, but it also, it helps wound healing. People tend to look more youthful because of the changes that occur in the skin and that kind of thing. So it can help for people that are interested in that. But again, I'm much more interested in the whole body anti-aging from the inside out, I like to call it, for people, because that's, if we have the energy to do things we want to do, it just improves our quality of life tremendously.
Absolutely. This is amazing news, and we're so excited to offer this to our patients and anyone that is interested, because the countless therapeutic benefits are, you know, the list goes on.
Let's see. Do we have any questions? Do you have any more questions?
A little bit about.
Go ahead. Go ahead.
Yep. So you did touch base on this, but just to really drive it home, why do you call the hyperbaric chamber the chamber of youth?
Oh, yes, yes, yeah. Well, I like to call it the chamber of youth. You know, I believe it was Ponce de Leon, you know, back in the 1500s, he landed in Florida and was hunting all over Florida for the fountain of youth that he heard was there, and he never found it. I call the hyperbaric chamber the chamber of youth because, again, even though it really cannot reverse all of our biologic processes, it does reverse the inflammation, the poor circulation, you know, so it reverses some of those processes that lead to aging. And, you know, it's the closest thing we have to, as I said, the chamber of youth, to anti-aging. It even, you know, people who are crazy about stem cells in order to, you know, help slow down that process or to heal things. Hyperbarics, once you get above a certain number of hours in the hyperbaric, it actually causes stem cell release, both in the brain and in the body. And that helps to repair tissues in the brain and the body, and helps to rejuvenate and regenerate. So that's why I like to refer to it as a chamber of youth when we are discussing this particular topic.
Awesome.
When I see you all next, I'll look 10 years younger.
Awesome, Dr. Vinny, you heard it here first, folks. So if you were interested in really aging gracefully, getting down to the cellular level, please give our office a call at 609-512-1468 to learn more about hyperbaric oxygen therapy. But thank you, Dr. Vinny. This was very informative. Let's see if we have any questions from the chat.
Yeah, let's see who's.
Dr. Vinny, I have another question. This is actually on our Facebook comments from Kavita. She says, I'm all in, but I'm concerned about the side effects, specifically barotraumatic or ocular issues or lung oxygen toxicity.
So let me address the lung oxygen toxicity first. So yes, there is an oxygen dose that people can get toxic. Actually, in the chamber that we're in, you can't even come close to that, because it's about, you'd have to get about 1,440 oxygen units, which means you'd have to be getting like 100% oxygen for like 24 hours. That's where that number comes from. In the chamber here, you're getting less than 200 oxygen units in a day, and that number resets every day. So there's no concern here. People who are in this is a soft-sided chamber, meaning that it expands. It's not the hard-sided chamber. Hard-sided chambers, you can get up to 3 atmospheres of pressure, usually in doctors' offices, hospitals, and places where deep sea divers go can get up to well over 3 atmospheres, 6 atmospheres or more. So those people do have to worry about oxygen toxicity and take oxygen breaks and that kind of thing. But in this chamber, you cannot get oxygen toxic, especially if you're doing an hour and a half. We have people going in there up to 3 hours in a day, and there's no concern about that. Most people, when you're the barotrauma, when you're diving, we make sure that we take people down nice and slow and easy, so it's easier for them to clear their ears. People should never have pain inside the chamber. There's going to be barotrauma, there's always pain. And if there's pain, we're always looking to mitigate it. We'll dump some pressure out of the chamber. And if people just can't tolerate it, we're not going to take them for a dive. This is not something that like, no pain, no gain. No, this is no pain, and you still get all the gain, and you should not have pain. So sometimes people come and they're congested and they can't get in the chamber that day because of congestion. So, you know, we understand that, and we just have them come back when things clear up. In terms of the ocular stuff, there's some studies over the long term that for some people can increase the rate of cataract formation. Haven't seen that yet, but that's reported with some people. It just depends on what the risk benefit is to people. Somebody who has multiple sclerosis, and this can make a huge difference in their life, they might, you know, they might want to do that. Other people who might be more at risk for cataract formation may not want to take that risk. But that is the one of the known side effects. But the thing that keeps most people from diving, if you will, being pressurized, is to worry about barotrauma. And as I said, we always take steps to mitigate that. We make sure people know how to clear their ears, if need be, if, you know, do the same things to going up in an airplane. So people need to have chewing gum in there so that they can, you know, that's the easiest way. We actually have a device that helps, that we can tell people to get, that helps them clear their ears. So there are multiple ways we can take care of that particular issue. So I think I covered all the points. Did I cover all the points?
You did, Dr. Vinny. That, yeah, very reassuring and good to know. Just like Dr. Leonti said, you're going to get support from him to make sure safety, as well as we have a dive master here that supports you through your session, and you are educated on how to properly clear your ears so that you have a smooth dive. All right, and I believe that those are all the questions on Facebook.
And, you know, also, you know, we can let people know that they could always call and do a discovery, if they will, for, you know, to talk more about their specific situation if they want, and, you know, see if, you know, my thoughts on how and if it can help them.
Exactly. Yep. So if you are interested in learning more, we offer a 30-minute complimentary discovery consultation. You could give our office a call at 609-512-1468 to schedule that. And we look forward to connecting with you. Are there any other questions from our guests in our Zoom chat? I don't see any on Facebook. Okay, no more questions. And Dr. Leonti, is there any additional comments or information you'd like to add on anti-aging and hyperbarics before we close out?
Nope, it only works if you do it.
Only works if you do it. And just like Dr. Leonti always says, amazing things can happen when you use HBOT over time.
Yep.
All right. Well, thank you so much, Dr. Vinny. This was so informative. And thank you for the valuable information.
You're welcome, Regina, and thank you everyone who showed up. Thank you for spending some time with us. You know, Regina, I think we'll do this. I was going to do it every other week. Let's go ahead and do it every week, I think, live with the doc.
Awesome. So we will be doing our live with the doc series with Dr. Leonti Thursdays at 12:30. So stay tuned for next week.
Okay, cool.
All righty.
Right.